it's a very pleasure being here today. My name is Rodin. I'm the founder and the CEO of Pharmotech. I hope that today I can bring some new information that can spread out around the world, because what we found with our R&D is something very important. So let's begin. What is the biggest health or non-health problem around the world, in the entire world, are the bacteria. Bacteria are present everywhere you are, in the air, on your skin, in the water, on animals, on plants. So they are invisible. You know that they are there, but you don't know how to behave in front of them. So today we bring a solution that probably you are using every day. Pharmotech has the only patent around the world for the multi-drugs bacteria infection treatment. So we have deposited the patent worldwide on CBD and formulation to treat multi-drug resistant bacteria. As you know, CBD is used for a big, for a big perspective of medical issues. For example, for cancer, for epilepsy, neurodegenerative problems, etc. We are focused on bacteria. The World Health Organization made a priority list on the bacteria. So there are, as you can see, there are a critical priority, there are high priority, and the bacteria we have targeted are in both class. So for example, for the critical priority, Pseudomonas aeruginosa, probably you know well this bacteria because is responsible of the nosocomial infection in the hospitals, not only for human but also for animals. It's a very well-known problem in hospitals. This is just to show how bacteria's interests are increasing in time. So you see here, for example, Pseudomonas aeruginosa scientific publication is exponentially increasing. So how it works, this thing of bacteria, because we have Pseudomonas aeruginosa on our skin, but when it becomes dangerous, bacteria, maybe you can't see it, but bacteria, when they develop, they produce inducers. So other bacteria, they can see, they can feel that there are other inducers, so that means they can reproduce themselves. And that means that at certain point, the bacteria becomes pathogenic. So with CBD, pure CBD, in our formulation, keep harmless one of the worst bacteria in the world. So about the discoveries, the literature of the use of cannabinoids in general as a multi-drug resistant bacteria is known. So as you can see, for example, the first one was something like 40 years ago, and was a full spectrum. So they made a test on full spectrum for the application of gram-negative, because bacteria are gram-negative and positive. Then Giovanni Appendino made another discovery about the antibacterial application of some extract, cannabis extracts. Then Pharmotech came already 4 years ago, discovering that CBD in our formulation is really efficient on multi-drug resistant bacteria, and we have deposited a patent. So today we are the only company worldwide with this patent. And of course, so first of all, you have to do research and development. So you have to find a new molecule. And when you find a molecule with a new pharmacological application, you have to know how to go on the market. This is development, but with the words is always easy to say it, but in practice it's very difficult. So when we made the discovery, we said, okay, The only chance we have is to create an antibiotic. So we need 10 more years to go on the market, hundreds of millions to do phase 1, phase 2, phase 3. So at that time we said, okay, let's go through this adventure. This is just to show our patent. So our patent, our patent has been considered novel, inventive, and industrially applicable. So now we made the PCT worldwide. This slide is for all those people that are in the CBD or THC or whatever else active principle. It's very important to study the behavior between different compounds. So CBD, of course, is a very safe molecule, but has, now I lost the word, but has many, with other medicaments. So when you have a client or a patient that is taking medicaments and wants to take CBD, it's very important that the doctor knows very well this procedure, because it's possible that antidepressive, for example, use the same pathway as CBD. So it's very important that the doctor always is updated on the decision of the patients. So this is our team. Myself as the CEO. For example, there is Cornelia Camara, was the old QP of Merck Serono. Our Christian Schirvel is our head of veterinary and was the head of Novartis. Cesar Serna is our head of R&D and is a very expert in bioengineering, bioengineering. So basically, Pharmotech principally is doing research and development. Then, of course, we also have our own products, wellness products. We call wellness health products, such as oils, creams based on THC, on CBD. And then we provide also the possibility to create white labels for other companies, as we are doing in Switzerland, in Europe. We have scientific partners. We work with different universities in Switzerland, with different hospitals. Now I will say exactly what we did with each partner. And it's also interesting to see the market value of CBD today and in the future, and the market value of multi-drug resistant bacteria today and in the future. So probably the bacteria health world is the biggest in the world. For example, only France is consuming 10 billion euros only for antibiotics every year. Is a huge number. Of course, there are many correlated problems with the utilization of antibiotics. For example, France is one of these countries in Europe that abuse of the antibiotics. For that reason, the bacteria become smartened and they create resistance to these antibiotics. For example, Pseudomonas aeruginosa is creating a biofilm, so the antibiotics cannot achieve the bacteria. So today, just to spend some words about our quality management. We have a laboratory in Switzerland. We already produce under ISO, two different ISO. One is cosmetics, one is medical device. And for everything what is food, of course, we do the hazard analysis, ACCP, and we already are behaving as a GMP. Because if everything goes well, in Q2, we will be full GMP for extraction and for production of drugs, medicaments. So today, as I said, we have health products, such as oils and creams. In the future, you will see the timeline we have, because as I said earlier, to go on the market with a medical device that you can do claims such as to prevent and cure multi-drug resistant bacteria is something very difficult. So we had the ability to reduce the time to market from 12 years to only 2 years. So the first little miracle we found, or vision we had, was to find the application of CBD as an antibacterial, and then to find the right way to go on the market with medical products. And we will be able to do medical claims. So what we are doing, we are working on non-wounded skin and wounded skin. For non-wounded skin, we will develop a whole pipeline of medical products for ophthalmological, topical, urological, gynecological, etc. And for the wounded skin, this was a personal experience. Once I get burned a lot, so I say I will use my own oil, so 3 applications per day, and the result was impressive from a skin regeneration and anti-inflammatory point of view. So we said, okay, let's do something for big burns. But big burns, the market of big burns is really pharma. It's very difficult to go inside. And we had the idea to create a nanoskin, 100% organic, and nanoskin created with bacteria, because it is a nanocellulose created by bacteria. We are able to put the CBD in the chemical structure of this matrix. We made two different solutions, one that is releasing the active principle and the other one is not releasing, so it's keeping the CBD or whatever else active principle for tactical reason, because when you do a product and the active principle is going to the bloodstream, it's more and more difficult about the regulatory. So we made 2 versions, but we are ready for the future. We already did the preclinical trials with the CHUV, it's the cantonal hospital in Lausanne, it's the Swiss biggest center for big burns. The result was very positive, very impressive. The professor Ann Lee that has conducted these studies, these preclinicals, she said that it's 30 years that she don't see something so efficient. So now this year we are going to the clinical trials. This is just to show you that in 4 years we will be on the market with the nanoskin, and in 2 years we will be the only company in the world creating natural, 100% natural products without side effects to cure the worst problem health in the world, the multi-drug resistant bacteria. Today, as we can see here in this show, we have many competitors. Of course, I'm sure that here at this conference, there are many good products, but the competition is very high worldwide, even in Switzerland. Everywhere you go now, in Italy, in Spain, everywhere, in Thailand, everywhere, you can find a huge pipeline of offered products, CBD-based or THC-based on the market. Of course, you always have to be very careful, because as the FDA made and how Swissmedic made in Switzerland, they made a research on the market. So they take all the products present on the market, and the result was very bad. So there are many producers and sellers that declare something on the label, for example, 20% concentration, and when you analyze it, there is only 1-2%. So always be careful what do you sell or what do you propose to your client patients. Where we will have not competitors will be on the medical side, because we'll be the only company around the world to have these products to cure and prevent multi-drug resistant bacteria for non-wounded and wounded skin. Of course, our R&D is going much further to go internally, because bacteria are infecting all the body, brain, heart, stomach, everywhere you can have an infection. So the R&D is very vast and very difficult also, of course. So this is the last, how can I call it? The last picture you will say, so it's something very positive. We have to finish in a positive way, and are the testimonials of our client. Today we work with several doctors, specialists in autism, in cancer, and etc. But we also work with many veterinaries. Our patent is for human and veterinary application. And on the veterinary side, the products, medicament products are, there doesn't, how do you say, for treating, for example, summer eczema for horses, there are not products. So we made just a test with the phytocomplex we have, and was simply incredible. So there are much to do also in the veterinary. Veterinary is a huge market. And if you think that even in veterinary clinical, they have problem with bacterials, nosocomial bacterials, is a huge problem. And then, if you want to contact us, please be free to contact us at any time. Thank you very much for your attention.